Hi everyone. Today I have with me Sheela Zelmer, physiotherapist and women's health coach. Sheila, thanks so much for being here. Let's start off by you telling us a little bit about yourself and how you came to do the work that you're doing today.
Awesome. Thank you so much for having me. This is really great. So I am a pelvic physiotherapist and a women's health coach. So I started in traditional physiotherapy, treating people's knees and backs and things like that. And about 6 years ago, I decided that I wanted to specialize a little bit more. And that's when I started in the pelvic health realm. And so pelvic physiotherapy is physiotherapy for everything below the waist. So I work with primarily women, but some men as well, for issues related to bladder issues. So bladder control, bladder urgency and frequency, as well as issues around sex. So pain, difficulty with sensation, difficulty reaching an orgasm, even low libido, all of those things. That's kind of my area of focus.
All right, so let's dive into what the pelvic floor actually is and why we should care about it. Because I know I send a lot of patients to you, and I'm so happy you're close by. And I know a lot of my patients really benefit from your care, from postpartum to fertility patients to menstrual issues to menopausal issues. Like my patient population is primarily, menstruating people or women. So yeah, shed some light on what the pelvic floor is for us.
Yeah. So, the interesting thing is when we think of the pelvic floor, we have some preconceived ideas of what it is. And the challenge is when we talk about anything that's below the waist, we have a lot of fear, we have a lot of shame that's kind of associated with it. And so there's a lot of hushed tones when we talk about it. But really, these are muscles just like anything else. And so we have muscles that run from the pubic bone in the front to our tailbone in the back. And they run from sitting bone to sitting bone. So it's a really big area, kind of like a sling. So I have a pelvic model here. This is someone lying down on their back, and this is the whole thing. Like, it's a really big area. And when we think of the pelvic floor, myself, because I'm dealing with it all the time, it makes sense to me, but we don't recognize that there are muscles there. And these muscles have 5 functions. So part of the function is to act like a sphincter. I think many of us can think of it that way. We think of, oh, it provides bladder control, bowel control. But these muscles also provide support. So support to lift our organs. Our bladder, uterus, and rectum has to be supported from below. They also provide like a sump pump. So if we think about all of the circulation that's in our legs, that has to get pumped back out of our body and into our heart and flushed out. And the pelvic floor and these muscles are responsible for part of that. These muscles also work as stability. They work with our core muscles to provide support for our back and our hips and our pelvis. And then the last one is sexual. They have to be able to stretch and relax to allow penetration, but also to be strong, to have engorgement and good blood flow for arousal and libido and those types of things. Yeah, so they have many, many functions, even though it's such a small area.
Yeah, I love that you actually brought out your model. I love that because it is so hard to visualize. And like you said, we kind of like ignore this part of ourselves, right? Like we're kind of disconnected from it. And
Yeah,
ultimately, at the end of the day, there's muscles there that also need love, just like our traps need some love and our arms need
totally.
some love. So, what can pelvic floor dysfunction look like? So, when the pelvic floor isn't functioning well, if it maybe has some areas of tension or laxity or scar tissue in there, what can that look like? What can people experience when that happens?
Yeah, great question. So if we think of the pelvic floor as having 5 functions, when it's not doing those jobs, we call that dysfunction. So it can manifest as a whole host of different things. We can have things like leakage. We can have things like bladder leakage, maybe bladder control issues. So we have this feeling of urgency or a lot of frequency associated with that. We can have things like a lot of swelling in our legs and pelvis, varicose veins in the legs, hemorrhoids, all of that kind of thing. We can experience things like prolapse, which is when our pelvic organs start to descend a little bit. We can experience that, but even issues with sex. So maybe sex becomes painful and tight. We have a difficult time having an orgasm, or maybe it takes us a long time to even get there. Maybe there's discomfort afterwards. All of those things, as well as things like back pain, because again, our pelvic floor is part of our core. All of those things can be manifested when we have pelvic floor dysfunction.
Yeah, so there's like a huge gamut of issues
Mhm.
that can come up if the pelvic floor isn't functioning well. I'd like to touch on Kegels. Can we talk about Kegels?
Of course, I love talking about Kegels.
So when let's say you're noticing pelvic floor dysfunction in someone, or there's a treatment plan that needs to be laid out, can you take us through like actually let's take a step back first. Like what do you do? Like how do you assess people? Let's start
Okay.
there, and then we'll go into Kegels and other things that you get people to do.
Okay, yeah. So when we do an assessment, I think like most of us, whether it is yourself, someone's family doctor, a nurse practitioner, another kind of specialist, when you go, the questions, the history is the biggest piece of this. So we really want a thorough history, understanding your medical conditions. If you're a menstruating woman, we want to understand your menstrual history. If you have had children, we want to understand that, but also reproductive history, sexual history, all of that. So a big understanding of how that is functioning and how that is maybe not functioning. Are you having any issues or concerns? And then we do a physical examination. So I do that with an internal examination, and that is done vaginally and rectally because we don't have separate muscles around the vagina and separate ones around the rectum. They go across both. And so we need to understand what both areas are doing. And so if it is a male client, now that is rectal only, but for a female client, we're going to be addressing both of those. And so we're looking for, how are the muscles functioning? Are they strong? Are they weak? And you touched on this a little earlier. We can have weakness that's not due to things being all loosey-goosey, but things being too tight. So I often use the example of my shoulders. If they are hunched up by my ears, they are going to be very tight. My neck is not going to move properly. And I'm weak in that sense. It is not that I am so strong and stable in that area. It is still weakness, but the solution is not strengthening. The solution is relaxation. And so we identify if our clients have too much activity in the pelvic floor or too little. And by far, more people have too much activity than too little activity. I think a lot of people think, oh, maybe I've had children or maybe I'm older, I must be really weak down there. And that is the exception rather than the rule, for sure.
Okay, so once you've identified, now let's talk about Kegels. Like
Okay.
where do we use Kegels? Because I know Kegels aren't the end all for everybody. There's certain situations you want to use them in. So what kind of situations would you use that in versus other exercises?
Right. So we want to strengthen a muscle if it is weak. And so we need to identify if you actually have weakness because of a lack of an ability to contract. So our goal is to get that muscle to contract and relax the right way. And so someone who might experience issues with a difficulty with the contracting might be someone who has prolapse or bladder leakage. Now, that is not to say that that's a recipe that anyone who has bladder leakage needs Kegels, or anyone who needs prolapse needs Kegels. But those are areas where we might tend to give someone Kegels. And on the other side, someone who has a lot of pain or discomfort, they likely have a lot of tension. And I think that makes sense. Like if I have a lot of pain in my shoulder, I'm going to be tensing that area up. So they are definitely not someone we're going to give Kegels to. We want to stick to areas where there is a true weakness. And in that case, we would be really judicious about who we're giving them to, because just like there's not one core exercise that suits everybody's body, there is not one pelvic exercise. And in some cases, like for example, someone who has a lot of urgency or frequency, whether that's for their bladder or even for their bowel, they have this inability to control their bowels. As soon as they feel the urge, they got to run to the toilet. Doing Kegels will actually worsen that, because that is actually a tension issue, not a weakness issue. And so again, making sure you have the right exercises is key.
Great. Thanks for sharing that and shedding some light on that, because like historically, right? Like the Kegels were the end all and be all of
Totally.
all pelvic floor
Totally.
exercises.
Yep.
And if we even something you talked about that, we a lot of us are hyperactive in that area. Like, and if we think about just our core and our pelvic floor, a lot of us tend to do this all the time
Yes.
unintentionally.
For sure.
Yeah.
Well, and some of that is even, I'm going to say, cultural. Like, I think, myself, I was brought up, I didn't want to have my tummy bulging. I was taught to always hold my stomach in for posture, even for your clothes to look a certain way, all of this. But again, when we're engaging our core like that, our pelvic floor is part of that. So if we're holding our stomach in, we're holding the pelvic floor in too. And it's not meant to be constantly engaged like that. So it's not an optimal function for the pelvic floor. And so some of this is breaking down habits that we've had for years. You know, I grew up doing like aerobics in the 80s and the 90s and everything. And it was always about hold your core in, keep it on the whole time, like go all day tensing your stomach up. And there are many of us that still do that. So we need to let that go. And that's part of letting the pelvic floor go too.
Yeah, and even as you're saying this, it's not just my core. Like I feel like my butt is also clenched, and
Yes.
like just everything is
You're
like this.
holding in the vagina. Yeah, we hold in the vagina and in the rectum for no reason. It's not that we have to pee so badly. We're just holding it. And so recognizing that, and that is key when we recognize that we are actually holding, because despite how sensitive that area is, we don't have a ton of sensation there. So it's hard to have that internal awareness of what's happening. But when we can connect and recognize, wow, I'm clenching my vagina or I'm clenching my butt, how do I let that go? That's the first step in terms of normalizing the tension in that area.
And are there any tips or tricks that you have for people for viewers or people who are watching to kind of start to bring more awareness to that area, or like little triggers for them to remind them to unclench?
So I think just like someone whose shoulders are up by their ear all the time, the only way to change that habit is to have a reminder. So I often encourage my clients to set a reminder on their phone. And unlike something like our shoulders where we can consciously drop it, it's very hard to actively relax the pelvic floor. So when we think about it, it's not like a mouth. You can't just tell it to open. It doesn't work like that. But what we want is to recognize that other influences influence the pelvic floor. And the biggest one is our breath, our diaphragm. So every time we take a nice, relaxed, full breath, I don't mean a forced push my tummy out, but like a nice, full, soft breath, the pelvic floor lowers and lengthens. That's the relaxation. So if you set a reminder on your phone, say every hour, just like we'd want someone to get up from their chair every hour, but every hour to take 3 to 5 nice soft breaths, you're going to be relaxing the pelvic floor. And soon it learns the efficiency of being relaxed, because being tense is not efficient. It requires more energy, more activation, and our body is inherently lazy. It wants to do what is the least amount of work. So when it learns, hey, I don't have to work so hard to be relaxed by doing this more often, then we connect with that better.
I love that, because it's also just a reminder to relax your whole body and to take deep breaths and basically support your whole health.
Yes. And you know, the interesting thing about our pelvic floor, these muscles are not like the muscles in your thigh or the muscles in your arm. Those are what we call like motor muscles. We ask them to activate, we ask them to relax, but our pelvic floor is autonomic, meaning it functions like our heart. So our heart is pumping all the time. We don't ask it to beat. We can't tell it to stop. And the same way we can't tell our pelvic floor, just let go. It's always working. If not, you'd be peeing just sitting here right now, right? And so the same things that affect our heart rate when we're too stressed, too worried, rushing around all the time, they also make our pelvic floor overactive. So what's good for our heart is good for our pelvic floor for sure.
Awesome. Great. And then what kind of people or who should be seeing a pelvic floor physiotherapist? I know you alluded to this at the front end of our conversation, and I mentioned, the kinds of patients that I typically send to you, but let's clarify that. Can anyone see a pelvic floor patient, physiotherapy therapist? And are there certain times in life where we should be maybe engaging more in pelvic floor physiotherapy? Tell us a little bit about that.
Yeah, so I think pelvic physiotherapy is, I mean, I think everybody should go and see one, even to have a baseline, a benchmark of where you're at. And so, what I often will encourage people from a health management perspective, like preventative health, taking care of our health, whenever we have transitions in our life from a hormonal and a health perspective, I think it's a good idea to have a check. So, once a woman begins menstruating, I think that's a good time to have a check. Now, we don't necessarily have to do an internal if a woman is not comfortable with that, especially if she's younger and is not familiar with that idea. She might not be comfortable with an internal examination, but even some of this basic information about how to breathe, how to let that area go, how to care for ourselves is very valuable. Certainly, as you're trying to conceive, if that is going to be in your life, we want that then. During pregnancy, after delivery, as you start to notice your periods changing in perimenopause, again, that's another hormonal change that can influence these muscles. And then once your periods have ended in a postmenopausal client, that we want to encourage them to have a look then. Often I will encourage women, once they've started with me, just like we go to the dentist every year for sort of a checkup, to have one checkup to make sure that these pelvic floor muscles are functioning properly, that there isn't any hormonal change that's resulting in changes to the muscle, because all of these muscles are very hormone dependent. And as we go through the natural hormonal fluctuations over the course of our life, we can experience some changes in how these muscles work too.
Amazing. And then obviously there's other situations that might warrant some extra support if someone has some kind of menstrual condition, some pain you talked about at the beginning. Low back pain is a common one that I know I send my patients to you for, but also pelvic pain, like pain with intercourse and all those sorts of things. And I really appreciate you. And I know my patients do too.
I think it's interesting because it's an area that is not well understood and not well talked about. But again, it's not something that you're going to need, months and months of treatment. It's understanding how this component works with the rest of your body is really, really valuable. So for sure, if you're having any issues like, bladder issues, bowel issues, issues with menstrual cramps and irregularity with your cycles, that's giving you things like bloating and some of the other things that go along with that, definitely we can help in that respect. And of course, with pain, back pain, pelvic pain, that's a big thing that we work with. Yeah.
Great. Thanks so much for sharing all that amazing information. How can people connect with you, and how can people, follow you and learn more from you?
Awesome. So I am on social media, of course. So my Instagram account is Sheela Zelmer. I'm on Facebook as well. I have a Facebook group for women, if they are interested in learning about some of these women's health issues. And that's called the Women's Health Community. And I have a website. My website is SheelaZelmer.com. So that's probably all the best ways to reach me.
Great. And I'll throw all of those links in the show notes for this video.
Amazing.
Sheela, thank you so much for being here. Thank you so much for sharing all this information about, an area we tend to ignore. I know there's a lot of people out there who are going to resonate with these messages. Also because as we go through life, we kind of take a lot of those symptoms as a given that they're just going to be there, like incontinence, especially, or prolapse, or, back pain, that we just have to age with them. So I love that you touched on all of those things and how we can proactively approach them at different stages in our life.
Yeah, for sure. And it's very empowering, I think, for you to have this area examined and to understand how it functions. And I think that alone is so valuable, for sure.
Thank you.
Awesome. Thank you so much for having me. This has been great.